Okay, so as a nail professional, probably one of the most critical skills you can have is knowing where that line is. The line between a condition you can totally service and one that, really needs a doctor's attention. So today, we're going to use some guidance from the Louisville Beauty Academy to make that line super clear. We're talking about how to recognize what you're seeing, protect your client, and when to make that professional referral. This is all about safeguarding both your clients and your career. Let's get started. This quote right here, it gets straight to the heart of the matter. Your job isn't just to make nails beautiful. It's to be a responsible gatekeeper for your client's health. Seriously, recognizing a potential problem, well, that's your responsibility. And referring them to a medical professional, that's what makes you a true pro. And this is probably the most important rule of the entire game. As a nail technician, you are trained to identify, not to diagnose. And let's be clear, this isn't just a suggestion. It's a critical, professional, and legal boundary. You are never supposed to say, oh, you have a fungus. Instead, you observe the signs, you see what's in front of you, and you recommend they see a specialist. That's the job. So here's how we're going to break this all down today. First, we'll talk about the #1 rule for every pro. Then, we're going to use a really simple green light, red light system to look at some common nail disorders. We'll even take a quick look at skin conditions. And then we'll wrap it all up with how this knowledge truly empowers you in your career. All right, let's dive into the pro's first rule. I want you to think of yourself as the first line of defense for your client's health. For real, your role isn't to treat or cure anything, but it is to master the art of observation. Seeing the signs, understanding the potential risks, and always, always acting in their best interest. So when you see something that just doesn't look right, the protocol is a really clear 3-step process. Step 1, recognize the signs of a potential issue. Step 2, immediately and, of course, politely stop the service. And step 3, calmly recommend that your client see a licensed medical professional to get a proper diagnosis. It's a simple, safe, and totally professional framework. Okay, let's talk about our green light conditions. Now, these are considered disorders, not diseases. And what that means is they're typically non-infectious, and you can usually go ahead and perform a service. The key phrase here, though, is with care. This is where your gentle touch and your expertise really get to shine. First up, we've got onychophagy, which is just the fancy term for nail biting. We've all seen this, right? Short nails, sometimes the skin around them is a little irritated. The LBA's advice is simple. Provide a gentle service. A little kindness and care are absolutely key here, and you can make a huge difference for this client. Now for onychorexis, think split or brittle nails, a lot of times with those vertical ridges. Because these nails are so fragile, the best approach is just kindness. Avoid aggressive filing, maybe suggest a good quality nail oil, and always, always handle with care. So what about those little white spots that pretty much all of us have had at some point? That's leukonychia, and it's usually just caused by a minor bump or knock to the nail matrix. The LBA tip here couldn't be simpler. Harmless. They are not a sign of a calcium deficiency or anything scary. They will just grow out with the nail. Easy peasy. Okay, time to shift gears and get a little more serious. Let's talk about our red light conditions. When you see these signs, all work stops, period. There's no proceeding with caution here. This is all about preventing the spread of infection and making sure your client gets the medical help they actually need, and fast. Onychomycosis, or nail fungus, is a definite red light. Signs can be things like discoloration, think yellow or brown, and the nail might be getting thick or even crumbly. The rule here is absolute. It is non-negotiable. You stop the service. This is highly infectious and requires medical treatment, no two ways about it. So a lot of people mistakenly call this mold, but those greenies are actually a bacterial infection called Pseudomonas. It usually happens when moisture gets trapped, like under a lifting enhancement. The LBA's rule here is so critical. You never, ever cover green nails with product. That just traps the bacteria and makes everything worse. Stop the service and refer them out immediately. Warts, or verruca, are caused by a virus, and because of that, they are super contagious. If you service a client with warts, you're putting yourself, your tools, and all of your future clients at risk. So yeah, this is another immediate stop. You have to protect yourself and your workspace. And just to make it crystal clear, here is the LBA's definitive checklist. If you see any of these signs, we're talking pus, bleeding, any weird discoloration, open skin, warts, swelling, you must stop the service immediately. These are the non-negotiable red flags. There is absolutely no gray area here. Of course, nails don't exist in a bubble, right? The skin that surrounds them is just as important. So the same core principles of recognize, protect, and refer totally apply here as well. You've got to look at the whole picture. Let's just compare two things real quick. So on one hand, you might see eczema, which looks like dry, inflamed patches. You can often work around that with caution, being really gentle and avoiding those irritated areas. But on the other hand, if you see edema, which is swelling caused by fluid buildup, that is an immediate stop. It can be a sign of a serious underlying medical issue that needs a doctor's attention right away. So where does all this leave us? Well, this knowledge isn't about being negative or turning clients away. Not at all. It's about empowerment. Knowing when to say, no, I can't perform this service for your safety is the ultimate way of saying, yes, I am a true professional who cares about your health. This is the mindset that the Louisville Beauty Academy is all about. It starts with having confidence in your own observation skills. It's not about being afraid, it's about being focused. You can say, yes, I can recognize disorders safely. And this just builds on that confidence. You have the knowledge, you have the clear guidelines to make the right call every single time. Yes, I can know when to stop service. And this is what it's all for. This is the goal. Every single decision you make, every observation, every referral, it's all rooted in this one fundamental promise that you make to every single person who sits at your table. Yes, I can protect my clients. So this leaves us with a really critical question to think about. We focused on nail care today, but this principle applies everywhere. From personal trainers to hairstylists to estheticians, that line between providing expert care and accidentally overstepping into medical diagnosis is one every true professional has to know and respect. Upholding that line, that's the very definition of trust.